hopes are rising for travel to some countries to open up in the coming weeks. What is the epidemiologist's view on what lies ahead? Professor Neil Ferguson is director of the MRC Centre for Global Infectious Disease Analysis at Imperial College London and on several committees advising the government. Good morning, Professor Ferguson.
Good morning.
One COVID death was reported yesterday. We have infections now at an 8-month low. As you look at the latest data, what does it lead you to believe we can safely do later this month and next month?
Well, I should first say the data is very encouraging and very much in line with what we expected. Whilst we're seeing cases actually plateau at the moment and they may start edging up, mortality, deaths and hospitalisations are still going down, and we expect them to continue to go down, maybe tick up a little bit next month, but only within a manageable levels. And so that puts us in a very good position to be keeping to the government roadmap, relaxing some restrictions in a couple of weeks' time and then many more in June.
You say things the data is as expected to a degree. Wasn't your team at Imperial College quite a lot more pessimistic a couple of months ago on what they expected to be happening in this period? Pessimistic, sorry.
So yes. So not particularly in this period. The period we have concerns, still some concerns about, but they're diminishing, is really late summer, early autumn. If we're going to see another wave of transmission, that's where it would take place. But the data on the vaccines is getting ever more encouraging, particularly the new data which was released just over a week ago about the fact that vaccines, even if you do get infected, if you've been vaccinated, you're less infectious. And so that has pushed our estimates of the scale of any potential autumn wave down.
So the risk in the autumn would be that we're not yet far enough along with a next winter vaccination programme, and indeed we might have imported a variant against which our vaccines are less effective.
I mean, that is the latter concern, the risk from variants where vaccines are less effective is the major concern. That's the one thing which could still lead to a very major third wave in the autumn. And therefore, I think it's essential we roll out booster doses which can protect against that as soon as we basically finished vaccinating the adult population, which should finish by the summer.
Right, so essentially we go straight from the end of one vaccination programme into the next.
Yes, but it's a lot better vaccinating, and the vaccines are getting ever more effective and will be updated to deal with these new variants. It's much better to be vaccinating people than shutting down the whole of society. I'm sure all your listeners would agree. And so I think with that one caveat, I am feeling fairly optimistic that we will be not completely back to normal, but something which feels a lot more normal by the summer.
It is striking that despite us being in a better place on vaccination and on new infections than certainly many countries in Europe, the EU looks a lot more positive about travel in the summer than we appear to be at present. The government appears to be.
I think first of all, everybody would like to safely reopen international travel. I think it's a matter of when and how. I mean, the EU in their statement did have a very strong caveat that they reserved the right to clamp down again if there were variants of concern. And I think that's everybody's concern at the moment across the European continent, that we don't want to see vaccination undermined by things like the South African variant spreading in an uncontrolled manner. But with that one caveat, if we can find ways of reopening international travel which mitigates that risk, then I think everybody would like to be able to have some opportunity to go overseas.
Does the South African variant worry you more than the one that's circulating in India at present?
So I should say, first of all, that the data on these variants is still very limited. We have a little bit more data on the South African variant than some of the other ones. The data we have at the moment would point to the fact that the South African variant is probably the closest to what we call an immune escape variant, something which can escape vaccine-induced immunity, maybe natural immunity, than, for instance, the Brazilian variant. A lot of work is being done on the Indian variant. There are actually two of them. One is more of a risk than another. At the moment, it looks a lot like the Brazilian variant. So we can't be sanguine about it, but it's still the South African variant, which is the principal concern.
So if we ended up in a position where social distancing, or the 1 metre plus rule to be specific, went completely in June, would that be something that makes you nervous, or do you think we can safely do that?
So we have factored these things into the modelling we've been undertaking. And so to be clear, we do expect transmission and to some extent hospitalisations and deaths to tick up in late summer if we completely go back to normal, but at a much lower level than we saw, for instance, back in December and January. So it's obviously a political judgment as to what is acceptable in terms of numbers of infections, but we don't see any prospect of, for instance, the NHS being overwhelmed, with the one caveat around variants I've already mentioned. So it's always a matter of judgment. The other thing is, of course, so long as symptomatic people still isolate, and we're probably going to continue the test and trace system at least for another few months, then that will keep some sort of lid on how quickly infections can rise.
Have we definitively now broken the exponential link between new infections and deaths?
So we've reset it. We haven't broken it completely. In the past, let's go back to December of last year, then about 0.8 to 1% of people who got infected would be dying. And that's probably gone down by at least 80%, maybe even 90% with vaccination, given the levels we've achieved. And so we've reset to a much lower level. We need to have much higher levels of infection in society in order to risk overwhelming the NHS. And we think that's actually unlikely to happen unless a variant comes along which resets that relationship again.
It looks like we'll be in a position of very few rules in the summer, which is maybe when the question of what is the responsible thing to do comes in more. Can you see yourself going on a foreign holiday this summer?
I haven't come to any conclusions about that. I think as I think about it at the moment, it's probably unlikely, but it very much depends on how low infection levels go across the country and across the continent.
But, I mean,
I haven't booked anything.
You haven't booked anything. I know. I'm just wondering if you are hesitating because you would look really carefully at the infection. Let's assume it is allowed. It's allowed to go to wherever, France, Italy. Would you still think that if it can be avoided, it's probably the responsible thing to do as a citizen?
I don't want to lecture people on responsibility. I think if, for instance, by the summer, infection levels in France and Italy are the same sort of level as they are here, then there's no risk associated with travelling overseas. The risk comes from going from a place like the UK with very low infection levels and going to a place with much higher infection levels and therefore having the risk of bringing infection back. If the two places are at comparable levels, and that's what the EU is saying, then there is no particular risk associated with the travel.
OK. Professor Neil Ferguson, thank you.
It's 20 to 8, and as we look at